We shall commence this module by discussing in brief about the social infrastructure. Social infrastructure is one of the infrastructure sector and typically includes assets that accommodate the social services. It includes the social infrastructure assets which include school, universities, hospitals, prisons and community housing. Social infrastructure does not typically extend to the provision of social services such as the provision of teachers at a school or custodian services at a prison. Social infrastructure is a subset of the infrastructure sector which includes road, railways, building, health, sanitation, school, airports, etc. Social infrastructure caters to the social needs of the society such as education, health, housing, etc. Infrastructure by its basic definition means something that helps in production. Here social infrastructure relate to the betterment of the society. For example, good student will ultimately tend to become good citizen as well. Growth with equity has been the focus of the Indian economic policy since 1960s. By 2020, India is projected to be the youngest nation in the world in terms of size. The given expansion of the working age population due to India being in the second stage of demographic dividend is both a blessing as well as a problem for India. India can achieve greater benefits which will dynamically keep on increasing if this bulge is used efficiently and effectively. But if this dividend goes waste, we will never be able to recover this credit and hence will have to bear its curse for a very long period. Despite the global shocks, India has not substituted much on the expenditures on welfare activities, especially for the vulnerable population. The success of programs and policies of the government lies in the strength of the institutional structures with strong public delivery systems as well as in the attitudes and mindset of the people. To ensure the conversion of outlays into the outcome, the role of Panchayati Raj institutions is crucial. Though significant outcomes have been achieved in the areas of poverty reduction, health and education, and more remains to be done. The government in India should work to weaken the patriarchal mindset of the society. This can be done with the help of media, civil society and others. The efforts should be made to empower women to realize the untapped potential and to help them to fulfill their ambition. The provisional results from the 2011 census, the first decade of India's declining population along with the declining fertility has dampened the pace of net additions to the population. Thus, the net addition between 2001 and 2011 is less than that of the previous decade by 0.86 million. The population of economically active population, that is between 15 to 59 years, or India's demographic dividend, has increased from 53.4 to 56.3% during 1971 to 1981 and from 57.7 to 63.3% during 1991 to 2013. On the health and education front, the percentage of older population that above 60 years of age has increased from 5.3% to 5.7%. The main problem to address here is that by just providing the employment will not increase the employability of the labor force. It is based upon many other factors such as knowledge, skills developed by providing higher education and training. The problem of low employability levels owing to the poor quality of education is accentuated by the fact that fewer students opt for higher education. While economic infrastructure is important for improving the productive capacity of a nation, social infrastructure is also required to improve the quality of the human capital. This consists of the facilities like health, education, housing, medical facilities, sanitation, drinking water, etc. In economic terms, educated and healthy people build a healthy nation with a healthy growth rate. Yet, social infrastructure in India does not receive the importance which it should. After studying this module, you shall be able to know the concept of social infrastructure, learn how education helps in building the social infrastructure, identify how the housing is important for the social infrastructure. Let us now study the social infrastructure in detail. Social infrastructure is not only required in any country just during the economics growth period, but it is required at every time during a country's existence. It reflects the social care to the underprivileged and provides hope and opportunities to physically and economically different able people to promote egalitarian growth. Economic infrastructure is sometimes distinguished from the basic economic infrastructure, which refers to a group of improvements in the land areas that are typified by the physical forms of capital investments for increasing the usefulness of the land for producing and habitation. Improvement of such types include those in the fecundity and fertility of soil, which are expressed in growing crops, in animal husbandry and in forestry. These include large scale systems of water management like desalination, water purification, irrigation and so on. Economic infrastructure refers to an extended group of improvements inclusive of the basic economic infrastructure. The prominent physical infrastructural improvements in this category are transportations, water management, power production and distribution, sanitation and communication. These are the capital intensive and are generally created and maintained by the government or by the private bodies under the control and regulation of the government. Social infrastructure refers to the improvements in the services like technology and healthcare, legal framework, administrative system, etc., which are very complex in nature. Provisioning of these infrastructures is very challenging because these require balancing the policy outcomes, community issues, service delivery and value for money. Reserve Bank of India data on expenditure on social services by the government as a proportion of total expenditure has also been showing a mixed trend. It had declined to 22.9% in 2012-13 from 24.7% in 2010 and 11, but increased to 24.1% in 2013-14 and declined again to 22.3% in 2014-15. As a percentage of GDP, expenditure on the social services has declined from 6.9% in 2009-10 to 6.7% in 2014-15, with expenditure on education increasing from 3% to 3.1%, on health declining from 1.4% to 1.2%. There was a steady rise in the absolute social sector expenditure by the government even during the global crisis of 2008 and 9. Government spending on healthcare in India is only 1.2% of the GDP, which is about 4% of the total government expenditure, less than 30% of the total health spending. The failure to reach even at a minimum level of the public health expenditure in India makes the issue of healthcare in the country to a ridiculous level. While it is important to recognize the growth and potential of a rapidly expanding private sector, international experience shows that health outcomes are closely related to the financial protections in both absolute and relative terms with respect to the health expenditures. Let us now discuss the health sector. There was a steady rise in absolute social sector expenditure by the government even during the global crisis of 2008 and 9. Government spending on healthcare in India is only 1.2% of the GDP, which is about 4% of the total government expenditure, less than 30% of the total health spending. The failure to reach even at the minimum level of the public health expenditure in India makes the issue of the healthcare in the country to a ridiculous level. While it is important to recognize the growth and potential of a rapidly expanding private sector, international experience shows that health outcomes are closely related to the financial protection in both absolute and relative terms with respect to the health expenditure. India has developed an extensive network of public delivery system for healthcare. This effort was recommended in the Bhore Commission, according to which health services is to be provided through all the primary health centers, each serving to nearly 30,000 inhabitants within its areas. At that time, the urban population of India was less than 18%. Since then, the urban population has grown over fourfold to 285 million of over the 1 billion people living in India. 22.6% of this 285 million lives in slum, according to the Government of India 2001 census. Now, even though over the plan period, the number of community health centers, primary health centers and sub-centers has increased substantially, infrastructure facilities remained inadequate. Of the total dispensaries and hospitals in the country, 46% and 67% are found in the rural and in the urban areas respectively. The larger outpatient care is monopoly of the private health sector. Of all the dispensaries and hospitals, 54% and 73% respectively are privately managed. According to NSSO data, about 24% of the urban population is living below the poverty line, and the lack of adequate public health facility which is likely to affect its health adversely. In economic terms, educated and healthy people build a healthy nation with a healthy growth rate. Despite the humongous importance of social infrastructure in India, it has not received its due importance. It not only presents the human face of the economic growth process, but also represents the very essence of the holistic development. Next, we shall move on to discuss the education sector. Basic primary education is largely provided by the public sector. Its continuation, however, is under a cloud as the quality of infrastructure is poor and deteriorating. The non-responsiveness of the state to the requirement of basic education can be considered to be the most important problem facing the education sector. Despite high enrollment levels and extremely impressive achievements in basic literacy, the fact remains that there is high number of dropout in India at school level. Unlike physical infrastructure such as roads and power, the efficacy of social infrastructure is dependent upon the delivery of services, and this has turned out to be a big failure in the Indian case. The reason is the lack of answerability of the educational establishment to its users, the children. Education provision of education for all in India has also largely been envisaged within the public delivery system, even though this sector has a significant presence of private providers. Since independence, India has launched various schemes and programs for increasing the literacy among all sections of the population through various programs such as Sarv Shiksha Abhiyan, Right to Education, Midday Meal, etc. The growing need to privatize the education has led to a boost of private education institutes in India. This is more apparent in the urban areas than in the rural areas, where informal population is more literate as well. As per the latest census of India of 2001, 80% of the urban population is literate as opposed to 59% in the rural areas. It has been repeatedly observed in India that education and health services in India are characterized by inadequate and inferior infrastructure, poor public service delivery, lack of quality choices for consumers, and fourth, lack of access, especially for the poor, due to a high dependence on relatively expensive privately provided services. However, this is not for the want of policy attention to this sector. Central and state governments have since independence been devoting substantial funds and public efforts toward the provision of education and healthcare. Somehow, the efforts have not yielded the desired results. The aspects of policy failure could be categorized as follows. The state was rarely engaged in the business of providing education. Despite this, access to some basic schooling was available to both the rich and to the poor. While access to education was perhaps not entirely egalitarian or widespread, the poorest could obtain some initial schooling for their children in an era when state subsidies were largely absent. Despite the ineffectiveness of the public funded school in India, the condition of the schooling in India is worse than ever. Perhaps as a result, post-independence India continued to follow a system that was considered seriously flawed, not because of its colonial nature, but because it was unsuited to the Indian context. School infrastructure does not only mean the physical availability of school, classes and other necessary requirements. It also requires clean and pleasant atmosphere, which goes on a long way in encouraging the school participation. Further, initiatives taken by motivated teachers and staff are essential for a meaningful schooling experience. The enrollment rate in India has increased by many folds, but this has not kept pace with the required facility to provide education. The quality of primary school infrastructure is poor, even so in the rural areas, although the urban infrastructure is also not in the threshold standard levels. The major condition is lacking of a good institutional body in terms of building, which in India are effectively made not concrete. Although there have been significant decline in the number of open space schools. The figure for the primary schools in the urban areas were much better, but the majority of urban schools also did not have such basic facilities. Even though the access to education is increasing, it can hardly qualify as universal. It is determined by a mix of factors ranging from availability and quality of education to a child's social coordinates. The key concern is no longer enrollment, attendance, transition, completion and learning outcomes are emerging as bigger issues. In all the states, the learning outcomes of children are way behind expected or acceptable standards. For example, in Uttar Pradesh, the study team found that children up to the age of 14 in the state were not able to read or write fluently in any one language. This presented very dismal picture of the state. This contradicts the rising number of enrollment rates in the state. The situation was not dramatically different in Karnataka. Those who could read and write either have literate parents and or attended the private tuition classes. The first generation school goers barely managed to recognize alphabets and could at best read a few words. Group discussions in the community revealed that most parents across the states feel that the quality of education has gone down. The teachers do not really care if the children of the poor learn to read or write. Teachers are not accountable for learning outcomes of children, especially in the light of no detention policy. The Government of India has funded massive expansion of infrastructure post-independence in both the urban and the rural areas. This has contributed to the enormous increase in the enrollment rates as also the basic literacy in 1980s and 1990s. However, education administration, the quality of infrastructure, teaching mechanism and curricular content leave much to be desired. A large proportion of those who are enrolled drop out from schooling altogether, while many others are observed to leave free public schools to join fee paid private schools, which are growing rapidly as a segment. Unlike roads and power, the efficacy of social infrastructure is as crucially dependent upon service delivery as on physical provision. The Indian educational establishment has largely failed in this regard, mainly due to the lack of answerability of the educational establishment to the masses it seeks to educate. Moving on to discuss the housing. House provides shelter. A good shelter is necessary for comfortable and tension-free living. The government provides housing facilities to many employees. In India, the formulation and implementation of housing program is under the state government. The center, however, supplements the state government. A. Rural housing schemes. Several schemes have been started by the government to solve the problem of rural housing. Under minimum needs program, house sites are allocated and construction assistance are provided to the rural houseless laborers, workers, artisans, etc. This scheme was initiated in 1971. The Indira Awas Yojana was introduced in 1985-86 for the poorest of the poor belonging to the scheduled caste and tribes and freed bonded labor in the rural areas. Houses constructed under this scheme are under the clusters so that the common facilities can be provided to those clusters. Housing Schemes and Urban Development Corporation has been financing the several housing schemes by allocating 15% of its resources to such schemes. B. Urban housing. Housing schemes started by the government in the urban areas are as follows. Social housing schemes for different income groups operated by the state and the city level agencies with the budgetary support and loans by from HUDCO, LIC and other financial agencies. As a part of Nehru Rozgar Yojana, housing and shelter upgradation for the urban poor was introduced in 1989 in cities with the population between 1 and 20 lakhs. A scheme for the footpath dwellers, night shelters, was introduced in 1988-89 to provide shelters. Later, sanitation facilities was extended to the pavement dwellers. Now, we will summarize what we have discussed in this module. The outlook for India on the human development front could be positive given the large demographic dividend waiting to be tapped. This demographic dividend will benefit India if its population is healthy, educated and adequately skilled. Unleashing the time-bound potential of demographic dividend is the biggest challenge for India. This calls for the massive investment in the social infrastructure, skill development and empowerment of women. One of the challenges is to deal with the multiple and sometimes overlapping programs. A mere markup each year is the budget for existing programs or starting some new programs will not suffice. What is needed is a zero budgeting approach with a revamp, reorganization and convergence of the social sector schemes with the minimum size prescribed for the schemes. Better service provisions can only come about with better maintenance and greater expansion of infrastructure. Greater infrastructure, however, would require greater allocation of public funds. These funds need to come from the center or the state. Local government are unlikely to generate enough funds to serve the infrastructure. Health and education requires greater decentralization within the government, greater public-private partnership, greater involvement of the consumers and the local governments and associations either through e-governance or sample surveys in the decision-making process. Education as well as the urban healthcare is poor delivery of the services that has exacerbated the consequences of the poor infrastructure. This is mainly the symptoms of delivery at the institutional level, at execution level as well as at delivery level. Thus, to alter or to bring about better results, it is required to effectively change these levels. The failure at any end can bring about failure of the whole process and hence the motive in itself. The continuation of both private and public setup providing services should be encouraged. This should not mean that public delivery should be at the cost of the private delivery at the cost of the public. It is important to ensure that public delivery mechanism is strengthened. Whatever be the difficulties in doing so, this is necessary criteria for the welfare of the underprivileged segment of the society. This requires that appropriate incentives be built in. A system of reward and incentives need to be introduced at all levels of the delivery hierarchy. Local government needs to be given the adequate task of regularly access the responsibilities of both health and education. They should be rewarded for good results and rebuked for bad as well. Both in the health and the education sectors, responsibilities have not been adequately assigned.